Hi, Erika. How are you doing?
Hey, Krystal, I'm doing great. What about you?
I'm good. Thanks for asking. So, I'm actually going to be meeting Nico today to talk about how he's managing his medication for his hypertension and rheumatoid arthritis diagnosis. The physician recommended that we go talk to him together to see how we can manage his medications and occupations.
Yeah, that sounds good. I also saw the referral from Dr. Smith. The last time I saw Nico, actually, I prescribed 10 milligrams of lisinopril and losartan for him to take daily. I hope the medicine is doing okay for him.
I hope he's managing well too. Our appointment with him is in 20 minutes in his room. I believe he's in room 432. Let's see what he says.
20 minutes later.
Okay.
Can we come in?
Yes.
Hi, I'm Krystal, your occupational therapist.
Hi, I'm Erika, your pharmacist. How are you doing today, Nico?
I'm okay.
Oh, that's great. How's the lisinopril and the losartan that you're taking?
It's not going so great, doctor. I forget to take my pills daily unless the nurse reminds me, and I'm experiencing some side effects.
I can definitely help you with managing your medication so you don't forget. And the pharmacist here can help with the side effects. What kind of side effects are you experiencing?
Well, I'm having dry cough. I'm not sure if that's normal, but I've been coughing more than usual. And because the cough is so dry, I think drinking water will solve the problem, but it doesn't solve anything. I'm also kind of nauseous when I take the medication.
Well, that's totally understandable because lisinopril, the drug that you're taking for your hypertension, definitely has a side effect of dry cough. And losartan, the drug that you're taking for your rheumatoid arthritis, has a side effect of nausea. If the side effects are too bothersome, I could definitely prescribe you a different medication for your hypertension and rheumatoid arthritis.
That would be amazing. I can handle the nausea since it's not too bad. But if you could prescribe me something else for my hypertension, that'd be great.
Yeah, no worries. I will prescribe 25 milligrams of hydroxychloroquine. The next time we meet, please let me know how that goes. And in terms of your medication management, Krystal, the occupational therapist, can help you. It's really important that you adhere to the medication, so please feel free to let us know if you are having any other concerns.
Amazing. I don't know what it is, but I keep forgetting to take my medication throughout the day.
Nico, that's totally understandable. Life gets busy and it can be hard to remember things throughout the day. Also, I would love to add that if you feel slightly nauseous taking your medication after a meal can help soothe the nausea.
Yes, exactly. Sometimes it's hard to think about what I have to do since I'm so busy with the kids.
Same here. My kids take up a lot of my time and I forget too. What reminded me to take my medication were phone alarms and a weekly pill organizer. You can usually find an organizer at any CVS or Walgreens. I've seen them at dollar stores as well.
That's a brilliant idea, Dr. Castro. You are so amazing when it comes to these kind of things. The new pill bottle you gave me last week is so much easier to open. It doesn't require me to use my fingers as much since this is a squeeze bottle. Thank you again.
No worries, that's why we're here, to help you with your medication needs and make sure that you're having an easy time taking them.
I'll try those out and let you know how that goes next week. The work you two do is amazing. Last week, Dr. Castro told me what kind of schooling she had to do to become an OT. What about you, Dr. Yi?
Well, it's really funny that you ask. My daughter had to do a presentation on pharmacists and what their role is like. Here, I can show you a video. You may be thinking, what exactly do pharmacists do? Don't they just hand out medication? Kind of, but not really. Pharmacists actually do a lot of things. They ensure that the quality of the medicine is good and meet the standards according to the law. They ensure that the medicine given to the patient is suitable, and they advise the patient about the medication given to them. Pharmacists tell the patients how to take the medication and what side effects that may occur. They also answer the patient's questions and what possible interactions may occur with other drugs the patient is taking. Okay, so now you're interested in becoming a pharmacist, aren't you? How do you become one, you ask? You need to obtain a doctorate of pharmacy. Most programs are 4 years after you obtain your undergraduate degree, but there are also accelerated programs available. Programs like Chapman University's is only 3 years. Other programs like the University of the Pacifics or Massachusetts College of Pharmacy and Health Sciences have entry-level doctorate programs that take 6 years to complete after high school. After getting your doctorate's degree in pharmacy, you need to take 2 separate exams. A national exam called the North American Pharmacist Licensure Exam, or the NAPLEX, and a state exam depending on where you decide to work. California's is called the California Practice Standards Jurisprudence Exam, or the CPJE. Like many other healthcare professionals, pharmacists work in a variety of settings. They can work in acute inpatient settings like hospitals. They can also work in infusion clinics where they administer chemotherapy. Pharmacists can also work in medication therapy management clinics, where they help patients with managing their medicine. Pharmacists in these settings help their patients with insurance issues, how to take their medication, and problems they may be facing with their medication. Other settings include outpatient clinics like ambulatory care. Now you know what a pharmacist does and how to become one. We interviewed a pharmacist named Arthur who works at a medication therapy management clinic to get a better idea of what their typical day is like and how they interact with an occupational therapist.
What does a typical work day look like for you?
So for me, usually most of my day consists of making phone calls to patients that pre-qualify for the MTM review. And pretty much what I do is when I contact the patients, verify their info to make sure I'm talking to the correct patient. I go down the list of medications that they're taking, compare it with how they're taking it versus how the doctor prescribed it, counsel them on some high risk medications, and then if I notice any drug interactions or gaps in therapy, I usually let the patients know about those, and then I send a fax to the doctor regarding those. And sometimes patients usually like mention if a medication cost is too high or if they're experiencing certain side effects. I can usually recommend some alternatives, but since I don't have the ability to change any of their medications, all I can do is just let the doctor know about that.
So, do you know how you would collaborate with an occupational therapist? I know you were saying PT, but do you like?
I
Do you
know occupational therapists have patients help kind of get them used to back what they were doing in ordinary life, like with their daily activities.
Mhm.
I've never done it personally, but I'm guessing like a pharmacist, since they're more on like the medication side of it, they could let the OT know about like certain side effects that may arise from the medications and how they may impact the patient's life. Like if the patient's in a lot of pain, they may be on opioids, which can cause a lot of sedation. So just letting them know that the patient may feel a bit lightheaded, they may have a high risk of being dizzy. So I think like just that aspect, letting them know about what to expect from the drugs and how that could help them with their jobs.
Mhm.
Wow, that was such a concise, informative video. Thank you for sharing this with me. So does that mean when you two work together, it's all about medicine and how I can take my medicine?
Yeah, it can be about medicine management, but it's also our duty to get as much information as possible to help you, our patient.
Yeah, for example, Erika, the pharmacist, and I, the occupational therapist, can also talk about how the medication affects you and your occupations. If your medication makes you drowsy, Erika will let me know and we'll work around that.
That's so interesting. I never knew that pharmacists and occupational therapists can work together.
Yes, we do work together. It's nice that different health professions can collaborate together. So, do you have any other questions for us?
Nope.
Okay, well, then we'll see you next week. Thank you for your time.
Thank you, doctors.
Bye.